Good morning, happy Easter. We're going to start stretching in just a minute or two. I want to check something. I'll be right back. If you're joining us today, make sure you have a belt or a rope, a chair nearby, and a textbook. Yep, a textbook or even a stair if you're close to a stair. I'll be back in 1 minute. Okay, good morning. Welcome to Sunday Stretch. I'm just going to tilt this a little bit. Good. Now we can get started. Happy Easter, everybody. Today we're going to do very similar stretches to what we did last week. Not exactly the same, slight variations on a few of them, not all of them. I like to mix it up just a little bit. Anyway, so like I said before, we need a chair nearby, a rope or a belt, and a textbook or a stair if you were close to a stair. So these are the top 10, 11 stretches that I give my patients on a regular basis. What we're trying to do here is we're trying to get people to go longer in between adjustments, in as much as if you do more exercises, take care of yourself at home, you're going to be able to go longer in between adjustments. And with today's coronavirus restrictions, many of you will be staying at home and not coming into the office as much, and that's good for you. You're smart to do that. So we're going to start today. I've been starting off most of my exercise routines by doing an up dog, and it occurred to me that it might be helpful for some of you to do an up dog version that you can do more regularly in different places, meaning if you don't have a yoga mat, if your floor is dirty, maybe you're outside, and you're going to do a run or something, arching backwards is probably the number one thing our bodies need to do more, meaning most of us are just like this way too much, and this becomes our normal posture. This is where we should be, so The ears are over the shoulders are over the hips are over the knees. What I'd like to do, instead of doing the down dog version, is to do version with a chair. So you can do this with a park bench outside. What you want to do is put one foot on the chair. Think about pushing your pockets forward. Don't think about just arching your back. It's not about just arching your back. It's more about pushing your pockets forward and leaning back, and then look up. Then you'll feel a stretch here. Take 3 breaths. 1, 2, 3. Same thing on the other side. 1, 2, 3. We're going to keep going like we usually do, 3 breaths at a time. 1, 2, 3. If you haven't already figured it out, I want you to take a breath big enough so that you can hear it. 1, 2, 3. Switch feet again. 1, 2, 3. 1, 2, 3. We're going to do 2 more on either side. A lot of people at this point may be thinking to themselves, what muscle am I stretching? Don't worry about which muscle exactly. We're stretching these muscles in systems, just like we would work our muscles in systems. Muscles never work in isolation. So why try to isolate one specific muscle when it's probably the whole system that's having a failure? Now, sometimes under certain circumstances, you do want to stretch one particular muscle, but those are pretty well-defined scenarios where you have a very specific injury. And so that's on an individual basis. So that's the standing version of the up dog. Next, we're going to do the straight knee bend. I'm sorry my head's chopped off a little bit, but I think it's better that you guys see the chair and my legs anyway. So for this one, again, you're going to put one heel on the chair and then bring your toes towards you. Take 3 breaths. What you want to do is make sure that this knee is straight. After 3 breaths, switch sides. When you do this one, make sure both feet are completely straight. If you do not take note of the down foot, meaning this is my right leg right here, I guarantee you that foot will twist to the outside. You do not want that. You want both feet like on 2 different railroads here. Bring the toes towards you. Let's call that 3 breaths since I was talking there. Good. 2 railroads, feet straight, toes towards you. Take 3 breaths. I don't want you to stretch forward. I know you're thinking, hey doc, I would feel more of a stretch if I was to lean forward a little bit. Don't do that. Please don't do that. I want you to focus on stretching the muscles behind the knee. These muscles are the most often tight. The muscles behind the knee and the muscles in front of the hips. Why is that? Well, those muscle groups shorten when we sit. And I'm not going to get into an argument with individual people about sitting too much. Just know that it's my firm belief that we all sit too much. All of us. And it's a society thing, it's a cultural thing, and I don't expect it to change. So might as well try to find ways to overcome or to compensate for our excessive sitting, rather than to fool ourselves into thinking, well, I'm going to try to get up more when I'm working at the computer. Well, that's fine, you're welcome to do that, but then again, your job, your livelihood is tied to how much you can be at that computer and get your work done. So regardless, you're going to be at that computer for about 8 hours a day. Getting up and moving around a little bit here and there is certainly encouraged, but it's not going to make a huge difference in the stiffness in your muscles. So consider that. Okay, we're going to call that 5. That may have been 6, but I like that stretch. So that one stretches a little bit of the hamstrings and a little bit of the calf muscles as well. Next one we're going to do, I did this one last time. I call it the Beyonce, because what you're going to do, stick your butt out, bend one knee, just hang out there. This is one exercise where I do want you to stretch the top portion of your hamstring. But I'd rather you do it one leg at a time rather than both legs at one time. I'm going to continue to talk, so you please continue to do the 3-breath pattern, like so. 1, 2, 3. If you can't tell what I'm doing, I'm going to lean forward and show you here. One foot comes up. Actually, I like the feet together more. Just barely bend one knee and hold that for 3 breaths. And then bend the other knee. But I want you to go through the pattern of straightening out the knee before the other knee gets bent. Why? Well, this has to do with the walking pattern. And the walking pattern kind of necessitates that your knee fully extends. If it does not fully extend, you're going to develop some hip problems and probably come see me for low back pain. I lost track. I don't know if this is 4 or 5, but I like this exercise. We're going to do 2 more. After this, we're going to do 1 more on either side. I call it the Beyonce because one of my patients called it that. I thought it was a great name. I don't know if you know who Beyonce is. All the single ladies. Video, go look that up and you'll figure it out. I'm going to stretch my left side one more time because I'm a little stiff on the left more than the right, which is not uncommon. Good. Okay. That was the Beyonce. Next exercise, put the chair away for a second. I'm doing this just on a carpeted floor so that you can see better. My yoga mat is blue and I tend to blend with the yoga mat, so I'd rather not blend so you can see more clearly. Side bends. Get your feet wide, but not so wide that you're falling down. Wide but stable. Slide one hand down to the side. Try to avoid twisting. Shoulder comes up, arm comes up. Again, try to avoid twisting. Twisting is not really a part of this. You should feel a stretch here and into your hip a little bit. If you feel like you're a little unstable and your feet are slipping apart, go ahead and bring your feet a little bit closer together. Or you can take your socks off if you're slipping, which is what I'm going to do, because on this carpeted surface, my feet are slipping. Helps you get a better grip. There we go. Keep breathing. I'd rather you count breaths than just counting seconds or counting whatever. You may notice that in some of these positions, it actually is more difficult to take a full breath in, which surprises a lot of people. But think of it this way. If you're getting into this position and holding your breath, think of that as a signal to your body to say, hey, this is an extreme position, don't get used to it. By breathing, you're telling your body, hey, this position is okay. Try to relax into it a little bit more. I lost track again of the count. You know, that's funny. I used to do that as a personal trainer all the time. I lost track of the numbers. My clients would get kind of annoyed, but I tell them it really doesn't matter all that much. 1 or 2 repetitions here and there doesn't make that big of a difference in the big scheme of things. Okay, so that was side bends. Next one we're going to do is one I've been playing with a little bit. You could call it the frog or the horizontal squat. First of all, get into a what we call a quadruped or horse stance position. But your hands need to be more underneath your shoulders, not way out here. I'm going to move this way. Slide your knees apart. Good. Now come forward. Now back. I expect that you would feel this more when you come back. Where would you feel it? Probably more in the groin area. 1, 2, 3. If this is annoying your wrists, you can certainly come down to your forearms and elbows. It's not that big of a deal. Forward and then back. Hold in this position. Breathe. 1, 2, 3. I'm going to do this one so you can see me from the side, so you can see that it does kind of simulate a squat to some degree. And settle down, bring your butt towards your heels. 1, 2, 3. Come up. Butt down again. 1, 2, 3. If you're wondering where your head should be, it doesn't matter too much. Just generally look down or look at your hands. 1, 2, 3. My body seems to want to do 6 repetitions of everything today. I think I'm a little sore from chopping wood yesterday. Last one. 1, 2, 3. Okay. If you're grunting, that's probably good. That means you're doing something. Okay, that was the down frog or the frog exercise or the horizontal squat. I know we already did this side bending. This time we're going to do a side lunge. And again, we're going to work these groin muscles, the adductor group, the hip adductor. Adduction is bringing towards midline. Abduction is to bring away from the midline. This one, I usually don't count the breaths. I just pause for a second or two. I think doing the increased repetitions on this one is more beneficial than trying to hold that one and breathe. Meaning each time you go, hopefully you can go just a millimeter further and stretch the groin muscle just a tiny bit more. But if you're noticing that your knees feel uncomfortable in this position, take this into consideration. This foot, when I go this way, supinates. The knee should be to the outside or over the foot. If the knee is here, you're going to have knee problems. If you push the knee out like that, it's going to be a lot safer for you. So knee position here, not knee position here. Also keep in mind that you can't compensate for the lack of knee movement by twisting the feet out. I want your feet to be on some pretty wide railroad tracks here. Keep going. but the feet have to be going straight forward. No twisting out at all. I lost track of the number again. We're just going to do one more on either side. All right. That was the side lunge groin stretch. Next one we're going to do, get your chair out again. This one's for stability. Use the back of the chair, and what I want you to do is grab your foot. Now I know some of you will not be able to do this. If you are able to do this, make sure you're holding on with the chair here for balance. Take the 3 breaths. Switch sides. If you can't do this one, just hang on a second. I'll show you what to do in just a second. But I want to share with the people that can do this one, I want to share with them that this knee should not be forward like this. This knee should be pushed backwards like that. You will feel a stretch in the hip flexor much more. Yes, it also stretches the quadriceps, but like I said, a lot of these go in systems, not necessarily good to try to isolate one particular muscle. So, took this one off of a robe. You can use a rope, a belt, whatever you got. If you're doing the standing version, continue to do so. If you're joining me with the floor version, wrap the belt around your knee. Bring the leg behind you. Pull the foot towards your butt like that. You should be able to get some pull in this position using a rope or a belt. Switch sides. Put the belt underneath the knee. Roll to your side. Slide the belt down to your ankle and then pull. I'm not feeling much here, but I'm just going to continue to do this along with the seated or with the rope version people. And if you're doing the standing version, you're going to get a couple extra repetitions here, but I like that because this is an important stretch for a lot of people. Again, I don't care too much about what exact position your upper body is in. All I want you to do is try to get your heel towards your butt. That's the most important thing. And I seem to be talking a lot here, but just know that as I'm talking, I want you to keep focusing on the breathing. One, 2, 3. I'm going to do one more on either side here. Actually, I'll do it from this angle. Maybe you'll see something differently. Nah, probably not. Pull it down to the ankle, pull it towards you. 1, 2, 3. In the future, if you want to do this one with a pillow for your head, by all means, if it makes it a little bit more comfortable for you. Good. Pull the rope or the belt down to your ankle. Pull that towards you. Again, you want to have your knee underneath your hip here, not your knee all the way forward like this. But some of you might be so tight that this is the best you can do. That's fine. Do what you can. All right, we'll call that 3 breaths and we'll call that exercise good. Next exercise, we're going to twist this a little bit. I'm going to get down on my knees. You can do the standing, but what I'm going to do is just do a pec stretch. Now, what I don't want you to do is this. I don't want you to bring your shoulder to your ear. I want you to relax this shoulder. And yes, you're going to be pushing forward, but try to keep everything relaxed here as much as you can. Otherwise, if you start doing this, you're not going to get much from this exercise. So just gently lean forward. Gently twist your head to the other side. Take the 3 breaths there. Like I said, you can do this one standing. You don't have to do this one on one knee like I am. We'll call that 3 breaths. One, 2, 3. Back to the first side. 1, 2, 3. So the pec muscles, you keep going, I'm going to keep talking. The pec muscles are oftentimes tight and short because of this type of posture. You keep going here. What this type of posture is everything we do, which is typing, driving, sitting at the table, eating. Shoulders come into this position. These muscles shorten. Pec muscles will definitely, if they are tight, will definitely bring your posture down and forward to the point where it causes pain and problems in numerous different areas. Very common sight of tightness. Please, please, please try to avoid thrusting the shoulder up while you're stretching. Allow it to relax. I would rather you keep it relaxed than keep breathing and get less of a stretch and go less intensively on each stretch rather than and hold your breath and not get anything out of it. I'm convinced that if you hold your breath, again, your body is going to say, this is an extreme position, and it's going to tell your brain, don't bother getting used to this position. It's extreme. I'm holding my breath so I don't hurt myself. Well, if you can't breathe into this position, your body will never get used to it. You'll never get those pec muscles to relax and to release, especially if you're not breathing. Okay, I believe that was 5 on each side. Lat stretch. We're going to do this one near the wall again. You can do it standing. I'm going to do it kneeling. Reach overhead. Going to go that way. I'm sorry, the hand comes to the opposite shoulder, but you're leaning into the wall like that. Take the 3 breaths, of course. You might be feeling a stretch here in the latissimus dorsi muscle. You might be feeling it in the triceps muscle right there. Either way, it's another area that's commonly tight, particularly the latissimus. Take the 3 breaths. You can tell I'm a little stiff in this direction. My left arm in particular is not all that good at touching the opposite shoulder. Try to avoid curling into it like that. I'd rather you keep your body facing forward and gently push into it like that. Again, keep the breathing. I know I haven't been counting breaths. When I was a personal trainer, oftentimes I just called myself a glorified rep counter because I felt like most of my patients really just wanted someone to hang out and talk with. Sorry, they weren't patients back then, they were clients. I lost count again, of course, like I always do, but we're going to do one more on either side. Again, like I said, please do this one standing. Please keep breathing. One, two, three. Good. So that is the latissimus and triceps stretch. Next one is the biceps stretch. Yeah, the biceps can and do oftentimes get tight. Again, do this one standing for you guys here. But what I want you to do is make a fist. The thumb side should be relatively flat with the rest of the hand and the index finger. Put this flat side on the wall in the corner. Gently turn the opposite way. Yeah, you'll get a little bit of pec stretch with this one too, but a lot of people are also tight in the biceps. There's a good chance you'll be stretching pec minor in this one. Pectoralis minor is a muscle that is oftentimes tight and short as well. One, two, three. I forgot to turn my head on that last repetition. Good. Keep going. One, two, three. I'm getting a workout doing this on my knees here. One, two, three. Again, try to avoid lifting your shoulder. Let it relax. Focus on the breath. If you're not breathing, you're not relaxing. 2 more times on either side. One, two, three. One, two, three. One more time. One, two, three. Last time. One, two, three. All right. Is that it, or do we have one more? I want to throw one more at you here today. If you have a textbook nearby, I know I didn't tell you to grab one, but if you have a textbook, grab it. If not, just watch for a minute. Keep the knee straight. I'm sorry, bend the knee. We're going to do this version. Bend the knee. You can tell with the textbook my heel is hanging off, but I don't want it here. I want it here. Push the knee to the outside. So I'm going to get away from the chair. You do it with the chair for stability. Foot goes like that. Knee gets bent. Put body weight onto that front leg. Push the knee out. We're going to do repetitions with this one. What I'm doing is try not to twist your whole body. Try to just move at the hip and get the knee out like that. What we're doing with this one is we're trying to get some muscles in the calves and the foot to stretch. Why do we want that? Well, we want that because many people have tight foot and calf muscles to the point where their ankles and feet are stuck in pronation. As you can tell, my foot's going into this motion, which is supination. So If you can put your heel on the bottom or on the floor, go for it. My right foot seems to want to be able to do it. Yeah, there we go. My left foot, not so much. Many of you will not have this much flexibility in your feet, so you might want to use a smaller textbook, a less thick textbook. And I'm going off of our standard for this one, meaning this is one I like to use repetitions again, but I am doing each side numerous times before I'm switching to the other side. Usually you'll notice, I go from right to left, one repetition. For this one, it's just not, it's a lot easier just to stick with one at a time. Man, that left one is really tight today. There we go. That's a little bit better. How many am I doing on each side? I don't know. 5-ish. 3, 4, 5. Okay, I want to end up with the same exercise we did our first exercise here. This is the first time I'm showing you guys this exercise, but I think the standing version of the up dog again is very important, and if you can master this, it will benefit you greatly. Put one foot on the chair, keep the knee bent, think about pushing your hips forward, leaning back, taking the 3 breaths. For this one, I want your chin to be going up to the ceiling. Don't think about arching your back. Think about letting gravity take it. Push your hips forward and letting gravity take your upper back and your head. This will be the last exercise here. I think this is our 4th repetition. We'll call this number 5 on each side. If you're having problems with this one, and if when it's all said and done, you actually have more low back pain than when you started, give me a call. There is this very small chance that some of you have a low back condition that one is not necessarily advisable, particularly if you have pain shooting down one or either leg. A good indication to not do that one. 99% of my patients, that's a great exercise. 1 in 100, I do have to consider that you might be that 1 in 100. So if it's painful after you finish the 5 repetitions, that's a good indication to not do it again. If it feels better and you actually feel more loose when you stand up after the 5 repetitions, that's a good indication that it's a good exercise. Most people want to stretch forward, and I'm not saying that's bad, but most people already do stretch forward, and so for me to show people how to stretch forward more is very redundant. Most people don't reflexively want to stretch backwards, and so what I have to do is I have to teach people how to do that effectively without hurting themselves, and yet keep in mind that that 1 in 100 patients is still going to have problems. So there you go. That's our second Sunday stretch routine. That one was a little bit longer, about 40 minutes. Sorry about that. I hope you enjoyed it. Leave some remarks, positive, negative, whatever you like. I'm open to suggestions. If you guys have any ideas or questions, for future exercise routines. I'm going to try to do 1 or 2 a week. Lately it seems to be on Thursday and Sunday. So Thursday I've been doing more core, Sunday I've been doing more stretch. Let me know if you guys have any further ideas or suggestions. Thanks a lot. We'll see you later.